Welcome, everybody, to the Virtual Health Future of Care chat series. This is another one in our series of episodes with the virtual health team, talking about the issues, pain points, challenges, and obstacles to overcome in the care management, care coordination industry. Today, we're talking about a topic that's near and dear to our hearts, which is interoperability. So we've got a couple of our virtual health experts who have been deep in the weeds of the interoperability space and learning about it and bringing their expertise to bear for virtual health clients. So we're excited to talk with both of you. And today we've got with us Marcus Caraballo, our VP of Product, and Huthaifa Khan, our Director of Solutions Architecture. One of the things, guys, that we often hear about from clients is the gap between sort of the promise and reality of interoperability, right? Like, obviously, we've been talking about it for a decade. A lot of people are aware of it in our space, but it doesn't seem like the solutions ever quite stand up to the expectations, or a lot of times they don't. So I'm curious what you both have been hearing from our client base and our prospects and the folks that you talk with all the time about what's going on in the space and where those pain points and those gaps often expose themselves. Marcus, do you want to jump in first?
Yeah, I think the challenges we see are actually, pretty parallel to the challenges we see with workflow setup across CM, UM, and DM, right? Ultimately, you have different data schemas that you have to navigate depending on your architecture, right? Our customer base typically have from anywhere from 30 to 50 different data feeds. So you have kind of the challenge of reconciling the data models for each of those feeds with the data model that your kind of destination or source systems have as well. So reconciling those models, and then once you've done that reconciliation and you've built your integrations, right, and you want to expand your business, you want to add new pipelines, or you want to modify pipelines depending on, again, new strategic initiatives, new feeds you want to support, new kind of testing or proof of concept models you want to try out, right? You have to make modifications. So I'd say it's really the flexibility to make modifications once you've spun up your feeds is where a lot of the challenges arise, and then speed, right? So add in the mix, wanting to get live with the program rapidly, having to plug in 20, 30, 50 different feeds, and doing that fast, right? So I'd say speed, flexibility, again, same pain points we see on kind of the workflow configuration side of things.
Yeah, and I can weigh in a little bit there, a little bit further with regards to that ever-living problem of data interoperability and integrations, particularly within healthcare, right? As the technology within healthcare evolves and kind of the data that you have available to you to make those healthcare decisions expands, it's more about the idea of being able to keep up with it. I like to think about it in the same way that you tend to think about security and technology. It's a never-ending kind of process that you're going to go through. Whatever one human can engineer, another human can reverse engineer. And that's basically in security, it's you engineer something and it gets reverse engineered by someone else. In this particular case, it's kind of the other way around. Someone has asked for something that they need or have come up with a solution, and then you need to build a actual solution for that. And that's being seen across the world as healthcare organizations expand and kind of want to gather more and more data, and alongside things like much more robust and deeper meaning business intelligence, and now with the newfound ability for everyone to be able to use generative AI, the interoperability becomes more and more of a benefit to the organizations, and that's something that has been a challenge forever, and I think it'll continue to be a challenge over time. I think it's more about coming back to what Marcus mentioned about the speed and the flexibility with which you can create these integrations and really tie your systems together in a way that makes sense. Right? You've got organizations, payers, clinicians, care providers, all looking to get the most amount of information that they can in order to do their respective functions, right? Whether it's utilization management, whether it's care management, whether it's long-term care or chronic disease management, it only gets better the more data you have. So it's always going to be kind of that carrot on a stick that we're working towards. But it's one that I think is very healthy within the environment that we're working in, because I think it enables more technologies to be used and leveraged across a healthcare kind of situation. So yeah, I think that those challenges will continue, but it's more about being able to give organizations and IT teams the tools and the capabilities to deal with them as they happen and as they arise.
That's great. Thank you, guys. I think, we've talked a bit about the challenges and pain points that organizations face in the healthcare space when their data is siloed or fragmented. I think the key piece that everyone is focused on is how that impacts the patient and the member and the experience that they have, right? In addition to getting all the data into one place and making it interoperable across the organization, every organization is trying to improve and be competitive on the member experience as well. So any thoughts on how that data fragmentation and siloing impacts the member experience?
I can definitely tee us off on that one. The interoperability or a lack thereof has a significant impact on the patient experience, not just within the realms of the payer environment, where we're talking about what has, a patient already had in terms of treatment, in terms of cost efficiency, to say, okay, we don't want to repeat treatments that obviously haven't worked before. So in terms of real life impacts, one of the things that is, very personally relatable to me is the ability for specialists and deeper providers within the healthcare kind of journey that you go through to understand what you've already experienced and what treatments you've had, who you've spoken to, whether or not you've had to, repeat your symptoms multiple times over. When I was younger, I was diagnosed with IBS, so irritable bowel syndrome. At the time, almost 15 years ago now, if not a little bit longer, God, that feels a long time ago. One of the big problems that I had, and this was in a relatively centralized healthcare system back in New Zealand, was as they were trying to diagnose me, it was a chronic disease that people didn't really know very much about. So as a result, when I went from doctor to doctor, specialist to specialist, went through multiple clinics and hospitals, I found that it was very difficult to feel like I had any kind of continuity in my care. So if I was referred from one general practitioner over to a specialist, I would go through the whole thing of having to answer all of my questions again. If there were diagnostic results or treatments or schedules that I had tried, all of those things I had to repeat over and over, and that's frustrating enough for someone who's an adult who can articulate themselves well. It becomes quite frustrating for a younger kid who's trying to figure out what's going wrong with their body when the expert is asking them, hey, can you tell me some answers that you've already spoken about, multiple times before? So I think the interoperability of healthcare data there has a huge impact on the patient experience, right? It results in poorer health outcomes if you don't have that information available to you immediately, whether because of the emotional or mental stress that a patient faces, or a delay in decision-making for treatment. Right. And when you think about my particular situation, the significant impact there was more mental and a day-to-day thing. Whereas when you start talking about someone who has a potentially terminal condition, right, whether it's cancer, whether it's an infection, the time to make those decisions is super, super important. And I think interoperability plays a huge, huge part in that, especially when you're dealing with niche health issues that can't be handled by a general practitioner that you see on a regular basis, and it's someone that you're only going to see for this one particular issue and then move on from. There's just so many things that you can get into there: health equity across different populations, the experience that they have, and then when you get to the payer side, how efficiently can you use your health plans or the procedures that are available to you to get treated in a timely and reliable fashion. And I know, Marcus, you've got a lot to talk about as far as care management and utilization management goes when it comes to interoperability. So I'll chuck it over to you.
Yeah. So, from a customer standpoint, I think you touched upon most of what we're seeing as well, Khan. One major pain point in the market as it relates to just patient experience is really that those timely turnaround times on prior authorizations, right? So a lot of the times you'll have a number of disparate EMRs that have to communicate with, or provider portals that have to communicate with the payer system, right? And we're starting to see regulations, right? State-specific federal regulations that are requiring payers to expedite those turnaround times and really deliver them efficiently and streamline them efficiently across their provider networks. So really, without really leaning into a robust interoperability strategy, one, obviously from a patient experience standpoint and a provider experience standpoint, you have a pretty big uphill battle that you have to go against. And then secondly, as it relates to really being able to adapt to those kind of moving regulatory targets, you're also in a pretty challenging situation as well.
That makes sense. Obviously, as we said, everybody's trying to improve the member experience, and moving data efficiently through the organization has to be a piece of that. One of the things that we've talked a lot about, and Khan, obviously you've got a lot of deep expertise in the interoperability space, both with virtual health and from past roles. I'm curious what you've heard in the marketplace over that tenure about what payers and providers are really looking for. What's the key desires, the key solutions that they're not seeing in the market that are an opportunity maybe to solve for?
It's interesting because payers and providers serve very distinct roles within that patient experience pipeline, but they both want the same thing out of interoperability. Basically, the most amount of information available to them to make the most efficient decisions and the most effective decisions, both for a management of financials, as well as the best possible experience for the client. So for the providers, they want to be able to, when they send off a prior authorization, right, they don't want to then be asked, hey, have you thought about this? Have you thought about this? Have you thought about this? And the poor provider's like, if you look at this particular patient's records, we have tried all of that, right? So that instantly creates a situation where there's one less back and forth that you have to go through when dealing with an authorization. For the provider, the quicker they can get that authorization done, the more effectively they can say, okay, I'm going to schedule this, I'm going to provide you a referral, let's go ahead and get this particular treatment plan done. One of the biggest challenges that I think I've seen for both payer and providers is how much effort you have to invest in setting up each one of these integrations, right? So ignoring for a moment how many different organizations there are in the healthcare space when we talk about functions and roles, just thinking about a singular organization as a payer, the number of different IT systems and disparate functions that they have to connect to, their main concern has really been, how can I do this without it becoming a huge problem? How can I go about saying, oh, you know what, we're picking up a new provider who's now joining our network. How do I get all of the information that I need from you about your patient population that's relevant to me, right? How much effort do I have to invest in getting that done? Because that's something that they want to do on a regular basis. Because again, it comes back to being empowered by the data that you have, not just on your individual patients, but your population as a whole. Because certain subsections of your population are then going to dictate how you can more effectively and more proactively deal with other populations that are experiencing the same issues. Now, again, that reaps benefits for everyone. It reaps benefits for the providers, it reaps benefits for the patients, and it reaps benefits for the payers as well. So that's really what I have seen is really about being able to make decisions in a way that doesn't require as much back and forth, not just between people, but between your systems as well as being able to do so and expand that interoperability kind of network that you have without it causing you anxiety each and every time you hear someone say, oh, we have to integrate with this other system. That really has been my experience when it comes to what payers and providers are looking for. Even though they serve different functions, ultimately the core aspect of why that data matters to them is effectively the same.
That makes sense. Marcus, anything to add that you've heard from payer and provider clients of virtual health?
Yeah, I mean, I think it all boils down to speed to value, right? So I think in a provider dynamic, ultimately, again, they have a number of different systems that they have to interface with, right? Typically, especially on the payer side, if they're dealing with multiple payers. So what I think they want a path of least resistance way to spin up those pipelines, right? To be able to path of least resistance way to change them. And ideally less pipelines, right? So maybe some centralized kind of mechanism that maybe routes information to the respective systems that they need to interface with, right? But again, I think it all boils down to just simplification, right? And I think on the payer side, pretty much the same thing, right? I think they have, they are regardless always going to have to deal with a number of different systems, but how can they, one, do it in a way that requires kind of the least pain, the least amount of pain as possible, right? And when I say that, least amount of pain, least amount of time, least amount of capital that needs to be allocated, right? And the most kind of adaptability, right? So we always like to say the cost of a mistake grows exponentially over time. I think that can become very apparent when you build pipelines that may be hard coded or are very complex, right? And very technical in nature. So to mitigate that risk, right, there's a level of, again, simplification I think folks are desiring so that, as they need to make changes, right, as they need to expand or contract, they can do so very easily with minimal capital requirements, kind of underpinning what needs to happen. So again, I think common theme, speed to value, and, just simplification.
That makes sense. We've talked quite a bit about the pain points and some of the maybe more negative aspects of where we are currently, but I want to close on a more positive note and kind of where we're going, because it seems like there's a lot of moving pieces in the interoperability space right now, and a lot of optimism, I think, about where we're headed, both in terms of centralizing and streamlining standards and starting to see, organizations really move towards things like the FHIR standard. So I'm curious what the two of you see that in terms of trends and evolution, and just where we think the space is going over the next couple of years to improve upon some of those pain points that we talked about.
Yeah, and I mean, Khan, he's been in the depths of Fireland for a long time, much longer than me. But as someone who's, on the VH side, we've had a number of implementations across a number of different types of customers and markets across the country. And historically, integrations for implementations and expanded business have always been, a challenge. We always get them done, but we always kind of have desired a way to do them in a way that was just much simpler and quicker. So I think one of the challenges, and we talked about this before, is the fact that when you're setting up these pipelines with disparate systems, a lot of the times we're speaking separate languages, right? So you have schemas across these systems that are different, say, than the schema that your system supports, right? From a data standpoint. So what FHIR does, or at least what we're seeing with FHIR, is kind of an adoption of a common, like, lingua franca, right? Common language that we can all adopt and speak and really work towards normalization, right? So ultimately, if we're interfacing with the customer that can support FHIR, right, the foundation of our conversation becomes, oh, okay, yep, these are the resources that we're going to be integrating with. Maybe, I guess the promise has always been when using FHIR that we have 100% parity. We're seeing that a lot of times that's not the case. But 80 to 90% parity is better than 0% parity, right? So when you have that common foundation that we're speaking upon, all of a sudden the process becomes a lot more streamlined, a lot quicker, a lot less painful. But Khan, you can expand on that in more depth.
Yeah, this is a topic that I could spend a long time on. I've been in healthcare tech for about 10 years in different areas, primarily dealing with interoperability solutions, right? And as technology has evolved with kind of data formats, you see JSON, XML, the good old standard CSV. There's a lot of different formats that you can send data in that either provide structure or simplicity to what you're trying to do. prior to FHIR being the new gold standard within healthcare interoperability, and I'm sorry to move back to a slightly negative aspect of interoperability, but a really positive effort in that regard was HL7 as a standard. So what's currently HL7 V2 is probably the most adopted as far as a lot of the EMRs and EHRs go. That had a very strong aim to standardize the data structures that we use to talk to different systems within a technology environment. And for the time, it worked very, very well, at least to begin with. One of the issues is the way that it was designed and the way that it was kind of managed over time is that you did see kind of like a big bang effect where everyone started moving further and further away from the very point that it began. And, you know, I've seen cases where a singular like organization, a singular entity that has the same EMR across multiple facilities within their organization, all of which have different implementations for the HL7 standard, right? So you would have to create an integration for each one of those facilities just to tie in with that particular organization. Now, that brings me over to the much more positive aspect of FHIR. By being able to utilize a lot of the newer technologies that we have, JSON is one of them and is generally the one that's used in most cases when sending FHIR around, is regardless of whether or not you might present or otherwise consider something slightly different, FHIR gives you the ability to interpret it as you need to. So where HL7 V2 kind of fell behind there in terms of the way that the data was structured, FHIR allows you that same standardization with a lot more flexibility in it, utilizing a lot of the stuff that we have available to us today. And one of the great things that you're seeing out of FHIR is a lot of these implementation guides. So FHIR in and of itself is an international standard. It can be used all around the world in its pure form. But as you need flexibility for certain domains and certain jurisdictions, for example, the payer system within the US healthcare domain, we've started seeing these implementation guides that basically say, yeah, you're conformant to the FHIR regulation. We're adding a little bit more on top of it, but you can very clearly state that that's what you're trying to do. And, you know, that is a really good indication of where we're going, which is, again, coming back to that point where I said it's an ongoing effort, that we're never going to get to a point where we have 100% parity. But FHIR as a standard alongside the technologies that it uses gets us a hell of a lot closer and gives the organizations, the payers, the providers, and even the patients in a lot of cases these days, the power to work within the situation that you're at the time. And one really other big thing about FHIR is that it's not just limited to your standard data format that you're sending. It's not just the zeros and ones that we're talking about sending between the different systems. It's how you go about requesting that information too. So they have a whole API framework around all of that, that once again kind of expands the ability for us to adapt while still speaking the same language, right? It really does give us a lot more flexibility, a lot more adaptability, and it also makes us a lot more efficient, because even if your structure is slightly different, ultimately the system that's receiving it doesn't really care, because it knows exactly how it should read that particular piece of data within its context of information that it's dealing with. So yeah, I'm really looking forward to working with FHIR more. It's definitely something that for me has been a godsend working in the interoperability space, because I don't know what I'd do if we decided to kind of regress back to something like HL7 V2. So we're in a really, really good spot at the moment where people are able to even drive the changes in the evolution of FHIR itself. There are working groups all around the world for the different domains that they're relevant to. And it really is an international collaborative effort, which I think is exactly what we need to drive interoperability further.
That's great. Thank you. This has been a great talk. I think I've certainly learned a bunch, and I'm sure our viewers will have as well too. And I know you both have we could go on for hours. You have a lot more to share, but I think it's been a great overview of the space, and I appreciate both of your time to educate me and our audience a little bit. This has been the Future of Care Chat on the promise and reality of interoperability with Huthaifa Khan and Marcus Caraballo. Thank you, everybody, for tuning in, and we'll talk to you all again.